Hi everyone, welcome to my presentation for Public Policy Impact and Assessment by me. The policy we will be discussing today in my presentation is the One Big Beautiful Bill. Started early last year, 2025, with the House looking to save money in different areas. This then went to the Senate, went back to the House, and was signed July 4th, 2025 by the President of the United States into law. The reason this one impacts nutrition is because of the sections that discuss changes in SNAP eligibility and the impact on school nutrition programs this funding cut actually causes. So who are the stakeholders? Obviously, the federal government are the ones who signed this into law. They're the ones that kind of are influencing and impacting the other people, right? So federal government signed this into law. This then affects the state government because they are taking away their funding that they give the states for SNAP benefits and supporting those programs. This then in turn affects the nutrition programs because the states have to rework budgets, maybe pull things from other places. One of those organizations or places that it could impact is school nutrition programs, thus affecting children and families. So like anything, there's two big viewpoints. Positive one, which is from the federal government's side of things. They believe it will give bigger paychecks on average to the people because less taxes are being pulled out of that to support SNAP benefits and those kinds of programs. More people in the workforce, they have increased the requirements to be eligible for SNAP benefits. You still get access to Medicare. That wasn't something that was pulled out, just the benefits for SNAP. And they believe this will reduce fraud because millions of dollars were going towards people who were actually not eligible, who were still getting the benefits of SNAP. Some negative viewpoints is reduced SNAP benefits affects children. So people who actually would qualify for it have special cases. This is now on the state rather than getting reimbursement from the federal government. The state will have to, like I said, reorganize budget and possibly pull from things such as school meal programs because SNAP kids automatically were eligible for free and reduced meals. However, with that no longer being harder to obtain, more kids could go hungry. This increases unhealthy eating in the home and in school. If the school can't afford these healthier programs because budget cuts are happening, more packaged and processed foods will be used. So what does the public have to say about this? Some worries are increase in childhood food insecurity. Less people are eligible for SNAP. These budgets are being worked around. Kids could go hungry. Systems that were in place could become compromised. Strain on the healthcare systems. This was interesting. There was a research article done how SNAP benefits being pulled away and Medicare remaining means that if people turn to unhealthier options because they are less expensive. Unhealthier options leads to poor eating, which leads to poor health, which puts a strain on healthcare systems, ER visits. Basically, the debt is just being spread out other places. Strain on state fundings for programs. They have to organize and rework how things went. And this causes things that were being run and given the appropriate funding to no longer have that. Policy implementations. We talked about this. It started with the federal government. It then affects the state and then affects the individual program, depending on how the state decides to rework everything. What is an RDN's perspective? Quality of nutrition could be cut with budget cuts. There's so many wonderful programs that include organic and healthy options, but with less funding from the federal government for SNAP, states could pull resources from these programs. Need to save money while also trying to feed more mouths within the school programs. Those kids that used to be able to eat free and that money was subsidized by the federal government, there will now be essentially debts on their account to feed those kids. And like I mentioned earlier, that debt is just being spread out to the healthcare systems and to the state programs, organizations. Higher strain on healthcare.